Right now, in thousands of pregnancies, a woman's blood vessels are quietly narrowing, and she has no idea. It's called preeclampsia, and it's one of the most dangerous pregnancy complications in the world. Not because it's rare, but because it hides. Here's exactly what's happening, why it's dangerous, who's most at risk, and what actually helps. Preeclampsia usually develops after the 20th week of pregnancy. It can also develop during labor or after delivery. It begins in the placenta, where blood vessels are supposed to grow wide and flexible to feed a growing baby. In preeclampsia, those vessels form incorrectly, narrower, stiffer, less able to carry the blood flow pregnancy demands. The placenta responds the only way it can. It releases stress signals into the mother's bloodstream. Those signals travel everywhere, damaging the lining of blood vessels throughout her entire body, not just near the baby. Blood pressure begins to climb. The kidneys, designed to filter waste, may start leaking protein into the urine. But protein in the urine is not always required for diagnosis. Preeclampsia can be diagnosed after 20 weeks when new high blood pressure occurs alongside protein in the urine or other signs of organ dysfunction, such as low platelets, impaired liver or kidney function, fluid in the lungs, severe headache, or visual symptoms. For many women, it feels like nothing. Maybe a headache they blame on stress. Maybe some swelling they blame on standing too long. Maybe blurred vision they blame on being tired. But underneath, the damage is spreading, and it doesn't stop at the blood vessels. Let's look closer at what's actually happening inside the body. The kidneys are normally excellent filters, keeping protein in the blood where it belongs. When their tiny blood vessels are damaged by preeclampsia, that filter starts to fail, protein can leak into the urine, and waste products that should be removed start building up instead. The liver can also become involved. Blood flow to the liver can be restricted, causing swelling and, in some cases, right upper abdomen pain, which is exactly why that specific pain is treated as a red flag during pregnancy, not just discomfort to push through. In its most severe form, preeclampsia can progress to something called HLLP syndrome, a condition involving the breakdown of red blood cells, elevated liver enzymes, and a dangerously low platelet count. HELP syndrome can develop quickly and is considered a medical emergency, sometimes requiring immediate delivery of the baby regardless of gestational age. And in the most extreme cases, preeclampsia can progress to eclampsia, seizures caused by the same vascular damage now affecting the brain. So who is actually at higher risk? First pregnancies carry a higher risk than later ones. Carrying multiples, twins or more, increases risk significantly. A personal or family history of preeclampsia raises the likelihood substantially. Pre-existing high blood pressure, diabetes, obesity, and certain autoimmune conditions are also linked to higher risk. And age plays a role too. Both very young pregnancies and pregnancies after age 35 carry increased risk. Knowing your personal risk factors isn't about fear. It's about knowing what to watch for. So what actually helps? Consistent prenatal care is the single biggest factor in catching preeclampsia early. Blood pressure checks and urine tests at every appointment exist specifically to catch this before symptoms appear. Knowing the warning signs matters just as much. Severe or persistent headaches that don't go away, sudden swelling in the hands or face, vision changes, significant pain under the ribs on the right side, or breathing difficulty. These symptoms require urgent assessment, especially after the 20th week of pregnancy. Managing blood pressure and blood sugar before pregnancy, when possible, also lowers risk. So does attending every scheduled prenatal visit, even the ones that feel routine, because routine is exactly when this gets caught. For women identified as higher risk, doctors have proven ways to help lower that risk, but that decision belongs in a conversation with a provider, not a video. What you can do today is simple. Know your risk factors, know the warning signs, and never skip a prenatal visit. The body doesn't always announce danger loudly. Sometimes it changes one number on one test weeks before anything else feels wrong. If this helped you understand your body a little better, subscribe now. The next health explanation may surprise you even more. And if you or someone you love has been through preeclampsia, share your experience in the comments. Someone reading it might need to hear it today.